Financial credit union offers checking and savings accounts, auto, home, and personal loans, and wealth management services. Desert Financial Credit Union is located at 300 North Beeline Highway, inside Walmart, and their number is 602-433-7000.
And a big thank you to Desert Financial Credit Union for sponsoring our KRIM Community Spotlight program. Good morning, RIM Country. Hope you're having a great Tuesday morning. And weather is beautiful out there. We're just spoiled. We're spoiled here in Payson, in RIM Country. We are going to be getting some cooler daytime temperatures. I think today forecasted highs around 82, and then we should be down in the 70s. So weather is just gorgeous. Well, today we are going to be talking about Medicare enrollment with Joanne Conlin. Good morning, Joanne.
Good morning, Chris. Thank you for having me on today.
You're so welcome. Thank you for coming in to share, to talk about some of the resources that are available now to people in Payson or in the RIM country, and also presentations. We'll be letting you know when these different presentations will be taking place, so you can get information on Medicare enrollment. So, Joanne, where would you like to start?
Well, I just want to let people know now we can get you can get information locally. You can get that one-on-one that we haven't had since actually it's been pre-COVID.
Okay.
I'm the local volunteer, and I volunteer under Pinal Gila Council for Senior Citizens. They're the area on aging for Pinal County and Gila County.
Mm-hmm.
And I've been in a lot of training lately, a whole lot since January, but I'm finally been allowed to reach out to the community now.
Mm-hmm.
And I just want to go over the different resources that are available now to our people. And it is anybody who's on Medicare, Medicaid, if you are on disability,
Mm-hmm.
these resources will help you. So I'll start, Chris, with the Ombudsman program. And that's kind of a funny word, ombudsman. People are like, what does this mean? And it's a Swedish word for advocacy. And what we do for the Ombudsman program is we protect resident rights in nursing facilities and skilled assisted living homes. So what we do is we work with the resident, and we honor what they want. And just to give you an idea of what some of the rights are for a resident, which I don't think a lot of people know, and I think it's important for families and friends to know when they're visiting somebody
Mm-hmm.
in a facility or a home, to be aware of these things so that people are protected. We've heard a lot on the news about horrible things that have happened.
Mm-hmm.
So
Yes.
I'm trying to be out there to help advocate for that. But it's a right to a dignified existence, to be treated with consideration, respect, and dignity. It's to be free of abuse, neglect, and exploitation. It's the right to make your own decisions, not to be told what to do. It's the right to be able to plan your care at the facility, not to be told this is what you have to do. You should participate in it. It's a right to make decisions on your financial affairs. It's a right to privacy, confidentiality, and a right to raise grievances that may occur in the facility without retaliation. And then also it's the right to access. So you should be able to invite your friends in at any time and not be told they can't come in.
Mm-hmm.
So, and to be able to go to the physician that you want to go to. And then a really big thing is that if you're being discharged or transferred, there's certain rights you have in notice and to be able to appeal. Because sometimes people are transferred or discharged and they don't want to be, and so there's a process that you go through. So we want to make sure that all these people they are aware of their rights and that they are treated properly in these facilities. And that's what I'm there for, is to work with the resident, and whatever they want is what I advocate for.
Now, is it a case where you might be contacted by a child or the children of a resident that are concerned that their parents' rights are not being honored, or that they're not receiving this treatment in a facility? Can that happen as well?
Yes,
Okay.
family, friends, they can make me aware, but I work for the resident.
Yes, you work.
So what I would do is go in and chat with the resident.
Mhm.
If they want to pursue it, we will pursue it.
Gotcha.
If they say no,
Mhm.
then I have to stop it.
It's completely up to the resident. Yeah.
But it does allow, I don't want children or friends to think that there's nothing can be done, because I know a lot of residents, they are afraid of retaliation.
Mhm.
Whether it's perceived or actual, it is, there's a worry there, or they're worried they'll get kicked out. But you can always go through Adult Protective Services, and it can be anonymous if you feel that there is something going on. So there are other alternatives if the resident says, no, I don't want to do anything.
Gotcha. And I guess you as an ombudsman, is this maybe a level before the protective services, where if a resident reaches out to you, talks with you, are you then able to, or is the next step, talk to the facility, talk to someone at the facility, see if there can be a resolution? Is that the goal of this position?
Absolutely.
Okay.
To try to get things resolved, work things out. We want to be a team. We want everybody working for the same goals. And that is, our residents definitely, they just want, they want what they want.
Mhm.
And I think every facility, we've got great assisted living homes here. Our skilled nursing facilities are wonderful.
Mhm.
The people care.
Mhm.
And I think, in most cases, things should be able to be worked out very amenably.
Good. So that is the ombudsman program.
Yes, that is the ombudsman program.
Yes. So what other services are provided?
Oh, we have so many. So we have what's called SMP, or it's the Senior Medicare Patrol. And what that deals with is Medicare errors, fraud, and abuse. And what I recommend people do is, one of the biggest things that people can do is not give out their Medicare number. When people ask for it, if it's not your doctor's office, or if it's not the insurance company that you are working with, do not give out your Medicare number. That's like giving out your Social Security number.
Gotcha.
And it's been noted that there's estimates in place that approximately there's $60 billion annually in frauds, errors, and abuse in Medicare.
Wow.
Yeah. So as an individual, we can all work towards paying more attention to your billing statements, to making sure that your Medicare number is not being used. If you go to a health fair and they want to do a free test on you, don't give them personal information. They can do that free test. But what happens, one of the fraud things is, in these health fairs, they'll say, oh, we'll do some kind of testing for you. They get your Medicare information, and then even though they say it's free, they end up billing Medicare when you never really wanted them to. You know, you go to a fair, you're like, oh, that looks like fun.
Yeah.
So you don't want those kind of things to happen.
Huh.
But they say that they've identified over $1.5 billion in fraudulent billings for medical equipment and $2.1 billion in genetic testing, which is sort of surprising. Yeah, so it's, you just want to really pay attention. You want to, if you see something funny when you get, every quarter people get statements from Medicare, and then they'll get statements from their, if they have original Medicare and a supplemental plan, they'll get 2 statements. One from Medicare and one from their additional, your supplemental insurance. If you have Medicare Advantage, you get 1 statement. Look at it. I advise you to look at it and make sure that what you're seeing is what you were supposed to get. You know, we trust our doctors, we hope everything is okay, but you really need to make sure, was there a procedure, maybe you canceled it, but they still billed you for it. But also, a lot of what happens is just a simple billing error. It's not intentional, it's just a simple billing error. So we want to make sure that it's corrected. So Medicare and your supplemental insurance are paying the correct amount of money. Because that $60 billion we could use to enrich the program.
And just want to mention, is this information and other information that you share today, is that going to be provided at the Medicare presentation on September 27th?
Yes.
Okay.
Some of it, yeah, it will be provided, and I've got ways to for you to help keep track of your services so that you can match what you were supposed to have done and what is billed.
Okay.
And you can always, and that's why I'm here. Sometimes people feel uncomfortable, and so I am here to help guide you through it, to make sure if you're confused with the bill, don't be frustrated, call me. That's what I'm here for, is to help you, okay, does this make sense? And then, you know, you can either call the doctor, or we can call together, or hospital, or whatever the case may be. But, you know, that's why we're here. We're here to help guide you through it. And then if it truly is fraud and abuse, then it goes to a different agency, and it is escalated. So it is, and that's how, you know, you read in the paper about all those horrible things that have happened, and now certain facilities are having to pay back money, and those investigations are going to go on for years. But we don't want that to happen to anybody here. So we want to help you through it, and really you know, make you aware of the do's and the don'ts.
Yes, so the Medicare presentation is September 27th at 5 p.m. at the Payson Public Library. That is open to anyone
Yes.
that is on Medicare?
It's open to anyone.
Or, okay.
So it is, you know, you may be becoming of Medicare aid, or you could just be a family member and you're a caregiver for an individual, you know, maybe your parents, they may have some confusion of some kind, and so you are helping them with all of their health insurance. So this would be a good thing for those family members or friends to come and just understand.
And then your phone number, if you can give that real quick, and we'll give it a couple times throughout the program, but your phone number, if people want to call you to set up an appointment, ask questions, what is your number?
928-595-2388.
There we go. And I'll also post that on our live stream. We're live streaming on my Facebook page and also our YouTube channel. So I'll put that out there for anyone that would like to contact Joanne. And so there's a lot of information, and that's where I know you have more information to share on this program, but I think you're really encouraging people to come to the Medicare presentation, to call you if there's questions, concerns, just really anything regarding Medicare, because these resources are now available for people in RIM country.
Yes, they are available, and I will say, I'm new to this, so I don't know anything. Well, I shouldn't say I don't know anything. I know some things, but not everything. And so I do have people behind me, very experienced people who, if I don't have the answer, or if I want to double check my answer, I will call these individuals I have one gentleman that's been a volunteer for 18 years, and he is my go-to on lots of different things. He's very, very knowledgeable. So what I don't know, I can find out for you.
It's great to have a resource like that available.
Yes, yes.
That you can tap into. So what is another piece of information about Medicare that you would like to share this morning?
So we are going to have the open enrollment. It's going to be October 23rd at the Payson Public Library between 10:30 and 12:30. And then on October 25th at the Isabel Hunt Memorial Library in Pine between 10 and 12. And the open enrollment is really important. It allows you, it's your annual election period. You may be very happy with the insurance that you have, or you may decide that you want to look at something different. And what we can do is we can compare plans. And people change, their lives change, their health changes, and we just want to make sure that you're getting what you need at this time in your life, but also what you're going to need in the future. We advise people not to look at what their family or their friends have, but look at what you need individually, what your spouse needs. You might not have the same plans, but you just want to plan appropriately and not be surprised that the insurance that you have now really isn't covering your needs. So we'll go over many things for open enrollment. You will want to review your current medical, health, and drug coverage. If you're dissatisfied, we will make changes for you. And there's just a variety of tools that you can use. You will want to bring your Medicare information with you. But in the open enrollment, because it's only going to be for 2 hours, we'll talk generally about stuff, answer lots of questions for you, and then I will have it available so we can set up individual appointments for you. Some people are very comfortable just with a little guidance going online on Medicare and doing everything themselves, and maybe at the end just calling me and saying, okay, let's talk about these programs, what's the pros and cons of each insurance policy. But some people want that step-by-step help as they enroll.
Okay.
But there is one thing, Chris, that people need to be aware of. If you change insurance, even during this open enrollment period, the new insurance company, they will take pre-existing conditions, but they don't have to take it for up to 6 months. So you really want to think about what you're doing, and you may want to check with the insurance company first, the one that you may be looking at, and find out, will they take this pre-existing condition? Or if you are getting older and you're just thinking, you know, I have a family history of cancer or heart issues, maybe I should just enrich my insurance. while I don't have any issues right now. So there's a lot of things for a person to think about. And that's what we'll talk about during that open enrollment time.
Mhm.
And then again, during the Medicare presentation, we'll be talking about it more.
Mm.
So just a lot of things to decide, but it's got to be your personal decision. It can't be what your friend is doing, because your friend has their own health issues.
Mhm.
And they also, everybody has different income levels, and you know what might be wonderful for one individual,
Mhm.
somebody else might not be able to afford it. So we need to find out what you can afford to give you the best coverage possible.
Mm. And it sounds like that it's advantageous to people to have a regular review of their Medicare plan, because like you said, situations change, our
Mhm.
health changes, different challenges, you know, might pop up that were not present years ago, and so the plan that you're on might not be best suited for where you are currently.
Yes.
So that is something, again, the Medicare open enrollment, the dates are October 23rd at the Payson Public Library, and then October 25th at the Pine Public Library, the Isabella Hunt Library in Pine. And again, this is general, just a kind of general overview or questions being answered, but then individual appointments can be set up at this time to take a closer look at your plan and questions you might have, and to find out if you're still on the best plan.
Absolutely. And another thing that we'll talk about at the presentation and then again at open enrollment, people aren't always aware of the help that's out there. There is programs that help people with different levels of income, either with their premiums and even with the Part D premium, they may get some help. So depending upon your income, there may be something out there for you. And you know, we'll go over all of that, and I can talk individually to you about it, and there is, I want to make sure that everybody is getting what they need and that they're taking advantage of any programs that are out there to help them. So we'll talk about that Medicare presentation and again at the open enrollment. And then individually, because sometimes people would prefer to talk privately and not ask general questions, and that's fine.
Mhm. Again, the Medicare presentation is September 27th at 5 p.m. at the Payson Public Library. All right, what other services or programs or would you like to share this morning?
Well, just sharing some things that the Area on Aging has, Pinel Gila. I don't know if everybody is aware of the wonderful things that are out there, but there's caregiver support groups, there's home care. They do have case managers here, and that help seniors and disabled with housekeeping, personal attendant and respite care. And then, of course, they partner with the wonderful Payson Senior Center for home delivered meals, transportation, and congregate meals. So, and they help with guidance on different meal plans, dietary restrictions, and then there's also, they are a funding source for them. So they're a great partnership together. And then there are different wellness programs. There's legal services, and the paralegal service that was pre-COVID that would come here once a month, they're going to be starting to do that again, which is wonderful because it helps people with rent issues. The paralegal will help with more of your simple legal issues. They'll help with wills. I'm not sure about trusts, but they do have a legal firm that they work with, that they contract with, to help advise when things get a little sticky. So watch for that. The paralegals will be coming here, I would say definitely by January. That's my hope. So there's a lot of good things out there for seniors, and you can call Pinnell Gila at 800-293-9393 to get more information on the resources available. And they will also help direct you to the case manager for your loved ones in Payson who might need some help.
Well, it's great. I think this is a great resource. You're a great resource for people in the community that have Medicare, that have questions, and it seems like there's always changes, or there's things changing with Medicare or with insurance in general, healthcare. So it's great to have someone that you can contact, that you can ask questions to, get advice, set up meetings, instead of just calling a number and getting maybe put on hold or trying to find the information yourself online. It can be very challenging for some people.
Oh, extraordinarily so. And I've experienced it. I had to get a form from Social Security so a person could enroll in Medicare after being employed. And I waited online for an hour to get the right form. And anyways, it can get very confusing and really frustrating. And I do want to take that frustration away from our people in this wonderful community. Let me be the one who deals with it. And it does require patience, because we don't always get the answer that we want right away, and sometimes it just takes a while for the enrollment to occur. But I am very diligent, and I will try to make sure that this wonderful community doesn't experience the horrible pain they've probably done over the past few years, since we haven't had any local people here.
Yes. Well, again, if you're watching on our live stream on my Facebook page, Chris Higgins, I put information, put Joanne Conlin's number, and also the meeting for the Medicare presentation. Again, that's September 27th, 5 p.m. at the Payson Public Library. And then Medicare Open Enrollment at the Payson Public Library on October 23rd, and at the Pine Public Library October 25th. Well, is there anything else? Just have a couple minutes. It's already almost 10:30. So a lot of information covered. Again, you can give Joanne a call if you have questions or would like to set up an appointment about your Medicare plan. And her number is 928-595-2388.
Okay, no, I think that's good. I just really encourage people to come to the presentation. Even if you're not going to be enrolling in Medicare right away, there's a lot of good information, and there's just things you need to start thinking about so that when you are ready, you're good to go. Because sometimes people do get surprised that they may enroll a little late, and there are penalties that are involved with enrolling late. So just want everybody to be prepared. And so please try to come out for that presentation. And for those of you, please come for the open enrollment, and I'll try to get everything answered that you need so that it's, if you do want to change or thinking about changing, you can make good decisions.
All right. Well, great. Well, thank you so much, Joanne, for coming
Thank
on this
you.
morning.
Well, I appreciate it, Chris, that you allowed me to come.
Oh, definitely. And thank you for all you're doing for residents in the community, helping them with their Medicare.
I am happy to do it. It keeps me out of trouble.
Thank you everyone for listening and watching. Also a big thank you to Desert Financial Credit Union for sponsoring our KRIM Community Spotlight program. Time to get back to the music with some Guns N' Roses, Phil Collins, and Little Feat. But first, let's get a quick update from the National Weather Service. All right, see you guys.